Hi, I'm Daniel Webster, Bloomberg Professor of American Health and Violence Prevention. Really excited about today's panel. We're going to talk about violence prevention, particularly in the context of racial justice. This is an important time, of course, for us to have this conversation given what's been going on in 2020 with large increases in homicides and shootings and a reckoning with respect to police violence and calls for change. I'm really honored to have with me on this panel some really esteemed panelists. Professor Charles Branas, who is head of the chair of epidemiology at Columbia School of Public Health. Professor Tracey Meares from Yale School of Law and the Justice Collaboratory there. And newly elected Mayor of Baltimore, Brandon Scott. So this is great to have you all together. I've been working in this field for 30 years and so excited that things are really ramping up with a greater attention to public health as a field that can really contribute to public safety. Three of us actually contributed to a recent report that focused on evidence-based solutions to reducing violence without reliance upon police and prisons with Professors Branas and Meares. I'm going to start the conversation off with Professor Branas, telling us a little bit about your work and what you've learned about changing environments to reduce violence.
Thanks, Daniel, very much for the opportunity to participate in this panel. It really is an honor to be with you and the other two panelists, including a sitting mayor. So I have to say that we began our work thinking about places and spaces as opportunities to reduce violence in a number of cities, going first to communities and asking them what they thought we should do to prevent violence, and particularly gun violence. And overwhelmingly, communities told us over and over again over years about abandoned places and spaces in their neighborhoods, the things that they saw every day when they stepped out of their homes to go to work or school. These were real challenges for them, but we also began to work with a number of different community groups and other municipal agencies in several cities to make these opportunities. Now, briefly, cities like Chicago, Philadelphia, Detroit, and so forth have been in a spiral of disinvestment that originated as a matter of structural racism. That if you look at, and I'm pointing to an article, there was a great piece in The Atlantic years ago by Ta-Nehisi Coates called The Case for Reparations, which was a moving piece for me, and it had maps of Chicago in it. And if you look at the redlining maps in Chicago, they match very closely with today's maps of vacancy and abandonment in that city. And it's the same in many other cities, including cities like Baltimore, Philadelphia, Detroit, Cleveland, et cetera. So this has been a spiral of structural racism, disinvestment, and abandonment in these cities that's led to an area the size of Switzerland, if you add it up across all cities in the United States. So this is a major challenge for spaces like this, but it's also a major opportunity. And our work has been seeking solutions that can change these places in inexpensive ways that can then be cast out across a city. This is not building the High Line in New York City. These are not luxury amenities and luxury destinations. These are spaces that are changed in small ways, little pocket parks or little treatments to abandoned buildings in cities, particularly in our most challenged neighborhoods and cities. And we've been finding significant reductions with the highest level of science when you make these sorts of changes in a city, in particular reductions to gun violence. These sorts of spaces are, they disconnect neighbors from each other and their surrounding spaces. So when you clean and green a lot or fix an abandoned building, you allow neighbors to connect with those spaces again and to connect with each other, but you also remove the opportunity for illegal firearms to be stored on those spaces in these cities and in neighborhoods that really need it. So I think I'll close just by saying that I think our cities, as I was saying, have been in the past 50 or 60 years or more in this downward spiral of structural racism, disinvestment, and abandonment, but we need to turn this around and make it an upward spiral and really begin to have our cities think about not just simply bouncing back, but bouncing forward, and changing places and spaces is a real opportunity for that. Thanks, Daniel.
Exactly the type of work we need to know and looking forward. I'm going to turn now to Professor Meares. I know you've been thinking a lot about all of these issues, particularly on the policing side of things. So as you look ahead to 2021, what are the things are you looking for on these issues of addressing systemic racism, and particularly as it relates to policing?
Thanks, Daniel. I really appreciate the opportunity to participate in this conversation. I want to connect with some really important things that Dr. Branas said, but before that, I want to speak to the moment. And in the moment, it's really important to think about what we can do to make the police service as it exists today more accountable and less harmful. I want to emphasize, though, that that's not the long-term project, right? So when we're talking about bouncing forward in the language that Dr. Branas used, making the police service as it exists today more accountable and less harmful is not a long-term project. It's an emergency project, if you will. It's a project of reversing the inclination to meet disinvestment with generally trained, general purpose, armed first responders as the only response to violence, which our report shows is not the best way to respond to violence. It's not the most effective way. It doesn't improve community trust in government leaders, not necessarily even talking about improving trust in the agents of the policing service as they exist now. But the fact remains, as you mentioned, we have a serious issue of violence and shootings right now that we need to respond to right now. And that needs to happen. And some of that work is work I'm participating in as a member of the monitoring team for the Baltimore Police Department, helping that police service as it exists today be better, be more responsive, be less harmful, rely on arrest less. So that is one aspect of my work in terms of how I think about what we should be doing. Going forward, I think we need to take Dr. Branas at his word by looking at this point about disinvestment. He mentioned a bunch of things that we can do now that don't cost a lot. But the reality is, once you recognize that disinvestment that has occurred for so long, we have to understand that to reverse that, to bounce forward, we have to make serious investment in our communities, led by what the communities themselves, how members of neighborhoods that have been disinvested in so long articulate as what they require for public safety in a holistic way. And you understand that those things require better housing, better education, serious investment in healthcare, right? And not simply meeting violence with general purpose armed first responders. Now, it turns out in the long term, those approaches will reap major investments. They will actually cost less. They cost less than prison, and they cost less than tens of thousands of police with overtime and guns. But in the short term, it will not be less expensive. And that is a reality, I think, that we all have to face up to. It's up what people are owed, in fact, going back to this point about disinvestment. And it's time to acknowledge that reality. And it's time to invest in what members of these communities articulate that's necessary for them to be true citizens of the communities in which they reside.
And talking about time, it is time for a new mayor in Baltimore, and that new mayor is Brandon Scott. Mayor Scott, you have been thinking about this problem of gun violence in particular in Baltimore from a public health frame for years as a leader in the city council. Now, when you look to your new administration, what does that actually look like? How does that public health frame help you think about how Baltimore is going to both reduce violence and also address some of the issues that we're talking about now with respect to structural racism.
Well, Dr. Webster, thank you for having me. But let me first say that what you've heard is the absolute gospel truth. We know, in fact, Baltimore, we have a street named after Preston Street, named after Mayor Preston, who passed the first redlining law that they took to cities around the country. And what we're dealing with when you talk about gun violence, a disease that has ravaged my city longer than I've been alive, right? But I can personally attest to it for 36 years. When I talk violence, I talk about it as the sowed seed of disinvestment in structural racism. That is a reality, and we have to understand that no one in Baltimore really is exempt from dealing with this disease or being impacted by it. I myself have been a victim of it. We know so many people that have been touched by it, consistently having to see that trauma. And we can't grow numb to the reality of gun violence that we have here in Baltimore. I think, and you've heard me talk about oftentimes about why we have to look at it in a different way, right? For the entirety of my life, the city government has been budgeting, thinking that dealing with violence, right, solving and curing this disease of violence has been the sole responsibility of a police commissioner and a police department. And every year that I've been alive, Baltimore has been one of the most violent cities in our country. So we know that we have to think in a different way, because what that looks like, why is it that when I go to the doctor right now, because my granddad has prostate cancer, every time I go for a checkup, they check me for prostate cancer. But continuously here in Baltimore, we have young people and citizens who their brother, their father, their mother, their cousin, their sister have all been impacted by this disease of violence. And we just expect that, oh, they're going to be okay. No, we have to think about how to stop the spread of this disease with the same vigor that we are talking about and focusing on the spread of COVID. And that's what we have to do, leading in different ways, understanding that, yes, we know that there's a role for us to, as we are reimagining public safety, to reform our police department, do all the great things that we have to and will do with the consent decree under my leadership, but that we also have to grow in our understanding of what public safety really means in a city like Baltimore. And that means that we have to do things in different ways. For example, when you're even thinking about policing, we talk oftentimes about the places and the people that are committing the overwhelming majority of the violence. You know, I am a full believer in a group violence reduction strategy, but that it just can't be about focusing in on the criminal justice side, that we have to bring resources to these people and their communities to allow them to do something differently. We have to focus on the flow of guns into our city, where 70% of the guns that we've recovered and tracked back to their origin this year alone come from outside of our city. But the most important thing that we're going to have to do as we look at the long term, right? Because fighting violence in Baltimore is an immediate and a long-term thing at the same time. We have to restructure the way the city budgets its taxpayer dollars to make sure that we're investing in the promise of our people and not just their failure. That's what we're going to have to do. The tough work, as was said before, that we're going to have to start now to making sure that we are operating through a lens of racial equity to go against the things that have been done in the city through systematic things for far too long.
So, Mayor Scott, there's a lot of things going on now in the city that, aside from policing, of course, to address the problem of violence. Any thoughts you have about how to strengthen those elements, the non-policing elements? Because in essence, what we're doing is we're trying to lift up and strengthen non-policing approaches. Dr. Branas talked about the place-based work, the work on the ground of programs like Safe Streets and other programs. I'm just sort of curious what thoughts you have now looking forward to your administration of, will those look different? How will we strengthen those?
Well, first, Doctor, you know that executive buy-in means the world. As you know, I actually had to lead the council in saving our Safe Streets programs from the brink of elimination a few years ago. But now it's about taking it to, as I often say, Safe Streets 2.0. How can we invest in them in a different ways, modernizing how the program operates? We should not still be operating the same way today in 2020 as we did in 2008 when we first started, right? It has to go from not just being about having those credible messengers and interrupting the violence, but then again, bringing a resource that now allows those folks that have mediate these issues to do and handle and provide for their families in a different way. The same thing goes for every other program, from We Are Us to Ceasefire to all these great organizations. What we have to do is actually get everyone together, support them in a different way with that executive buy-in, but also let everyone in the city know that, listen, no one person, no one program is going to solve this issue. Together is how we're going to have to solve it. We have to invest our dollars into these programs the same way that we've been investing our dollars into the sole source of policing as well.
Great. One thing that we haven't talked about thus far that I think is quite relevant when we think about public health frames and violence reduction and even the racial dimension to it, and that is density of alcohol outlets. And I wonder, Dr. Branas, if you want to say a little bit about maybe what those opportunities might look like and how availability of alcohol plays out with respect to community violence.
Mm-hmm.
Yeah, so availability of alcohol and alcohol outlets do provide opportunities to exacerbate community violence. And to the extent that certain types of outlets, particularly outlets that sell takeout alcohol, can be better zoned, we've shown, and others have shown, numerous others, that there could be opportunities to change gun violence. But I'll say more broadly, speaking to the mayor's brilliant comment, I think there are really non-police solutions here that are staring us in the face. Both panelists commented on this, and I also would advocate for the public health approach of really going back to basic structural changes so that we really can move forward in a sustainable way. Things like jobs, things like other socioeconomic, things like basic context and environments and places. These are really, really important. Alcohol outlets are one of those environmental changes that we might think about.
So Mayor Scott, Professor Branas mentions the importance of alcohol, something we've studied here in Baltimore as well. What's your thought about what you might be able to do to address this connection between density of alcohol outlets and violence?
Well, listen, this is something, Dr. Webster, and I was like chomping at the bit to chime in here, that I know personally. I've never had a drink of alcohol in my life, and that because of my upbringing, growing up in Park Heights, where, for example, in the 5100 block of Park Heights, there are like 5 liquor establishments in one block. That is what I deem. You would never see 5 McDonald's or 5 Burger Kings, one on each side of the street. They just wouldn't do that, right? And when you also see that neighborhood is one of our locations where we have a lot of violence historically, you can't separate the two. I was actually helping to lead the city as we went through our zoning code rewrite, where we found out 100 liquor establishments were supposed to be taken out of neighborhoods that they shouldn't have been in the first place in the 1971 zoning code rewrite. And in 2014 and 15, as we were going through a process, they were still there. And we still have so much more work to do, because we also know that some of those businesses can be reimagined into bodegas and others to help with food insecurity. And I think that we have to be creative and not putting businesses out of business, but making sure that they're providing services that are actually needed and not just oversaturated.
Well, great. We've covered a lot of ground. We've covered housing issues, important policing reform, strengthening community programs. I think this provides a really robust way to think about public health contributing to this problem when we look ahead to 2021 and beyond. I want to thank each of our panelists for a great conversation, and more importantly, really what each of you are contributing on this issue. You're great leaders, and really thrilled to have you part of this conversation.
Thank you. Thank you for having me.
Thank you very much.